Johnson, a physical therapist and back pain specialist, and today I want to answer your question as to why, if you have lower back pain, when you sit for a while, is it difficult to get up, right? So you might have some transitional pain, maybe originally a while back or in the recent past you've bent over, lifted something up, or were twisting and you noted some back pain. And now it's just like after you sit for a while, you have that long car ride and you go to get out of the car, it's like really stiff and hard to straighten up in your lower back. So here's what could be going on, all right? So a classic sign of a disc herniation is that stiffness going from sitting to standing, as well as central lower back pain. So if you have pain that's going across the belt line and it's tough to go from a sitting to a standing position, then it increases the chance that, or it leads us kind of further down the path of perhaps thinking this could be a herniated disc that's causing that issue. Now, why and how does that happen? We'll use a simple model that has some support, but it's really easy to help you understand what could be going on, okay? So right here, okay, this is the back. This is the back of the spine. This will be the front of the spine. Right here would be like the ridges that you would feel, okay, as you feel or run your fingers along the spine. This is the fourth bone in the back. This is the fifth bone in the back. This is the disc in between them. Here's the spinal cord and the nerves, okay? What we see is that this disc is filled with fluid-like material, all right? So it's sort of jelly-like in that it can move, and we have good evidence to show that. So what we see is that when you sit for a while, you can kind of see how there's some compression on the front and some gapping on the back end. So what you end up with, if we zoom in, right, is something like this, right? Well, if you were to put a jelly donut or something in between there, what would happen is that you would get some migration or some movement of the disc material towards the back of the disc, all right? So picture that, and picture now you're on a car ride sitting like that, or maybe sitting in the stand somewhere, or sitting at work, and the longer you sit there, right, kind of the more pressure has been put on the front, and the more, the greater the chances are that you've had some kind of movement of that disc material to the back, okay? Now what we see is that when you go from a sitting to a standing position, you try to reverse this curve, basically. So you can imagine how you're kind of bent forward like this, and then you go to stand up. Well, when you go to stand up, right, it's just the opposite. So then your curve reverses, right? So now you have sort of a little bulge back here and or some material back here or something back there that's, because you've been sitting in one position, has sort of caused a block, right? And that when you go to clamp down on the other side, there's initial pain and stiffness that you have to work through. And that pain and stiffness is felt sort of as you transition. As you get tall, you might notice that, as you kind of work into it or walk it off, it feels pretty good, okay, and you have less stiffness and you have less discomfort. So, and then, again, it's reversible. So if you go sit or you're bent over for a while doing something, and then you go to stand back up again, you will again notice that stiffness occurs. So this is a common thing that's associated with a disc herniation, and this is often the reason as to why you notice that transitional stiffness. So again, this video is for you if you've been sitting for a while, and or maybe that's what you do for work, or you drive for a living, and you notice that you have some type of stiffness going from a sitting or bent forward position to standing. This is likely what's going on or could be going on. So if you appreciate this video and it's helped you out, hit the subscribe button and or comment and like below, or send me an email directly at charliejohnsondpt@gmail.com.